welcome you all in this online teaching through Ayurveda network. In today's lecture, we will discuss the clinical significance of Takradhara therapy. Though this is not a Panchakarma, but it is very effective in the clinical practice as a supportive therapy. What is Takradhara? Takradhara is a specific form of Shirodhara therapy involving the continuous and precise pouring of medicated buttermilk over the forehead. As this is not explained in the classical text of Ayurveda, the main reference of Takradhara is we get from the Dhara Kalpa or Sahasra Yogam of the South Indian book. So, what are the indications of Takradhara is psoriasis, psychosomatic disorders, irritable bowel syndrome, diabetes or diabetic complications, neurological diseases and the stress. What material required for the Takradhara is Shirodhara device or Shirodhara patra, vessels, 3 to prepare the Takra, to prepare the Amalaki Koshaya or decoction and to take out Takra from the droni. We need 3 towels, 2 cotton plugs, 2 gauze piece of the 60 centimeter, 200 gram of Amalaki churna, 1.5 liter of milk, 100 gram musta and 10 ml of oil for talam, Rasnadi churna that is 5 gram and 2 attendant. The most important part is preparation of medicine. It is very hectic or difficult to prepare the Takradhara medicine. As in many institute practice, this is bypass. Many people bypass the classical preparation of Takradhara. So, here is the classical preparation of Takradhara. We begin with 1.5 liter of milk, which is then diluted with 4 times of water. We boil it with the diluted mixture along with 100 gram of skinned and crushed musta contained in a muslin bag. Reduce it until reaches its original milk volume. Remove the bag of medicaments and extract the content by squeezing it. Allow the prepared milk to cool. To initiate the fermentation, add a small amount of sour buttermilk or curd to the cooled medicated or slightly warm medicated milk and let it sit for the overnight or keep it aside for the overnight. The following morning or next morning, the churn the fermented medicated curd incorporating 500 ml of Amalaki decoction. After thoroughly removing the butter, use the resulting mixture of the dhara for the dhara procedure after the straining. For the preparation of Amalaki Kvatha, we take 200 gram of dried Amalaki fruit and boil it with 8 times of water, reducing it to the 2 liters. And we use 1.5 liter of Amalaki Kvatha to mix with the buttermilk and reserve 500 ml of the Amalaki Kvatha or decoction. We use it for the washing the head after the procedure. Coming to the preoperative procedure, as it is administered as a Shamana therapy, there is no requirement for preparatory Purva Karma. Usually we practice Takradhara after the Shodhana procedure in patients. Sometimes we use as a therapeutic procedure without doing the Panchakarma also when we need the Shamana effect of the Takradhara. Typically the application of oil to the head and body is performed as a customary practice. The selection of appropriate oil tailored to the specific ailments is determined by the attending Panchakarma physician. During the procedure, it is essential to make precautions such as covering the eyes with protective eye pads and securing gauze around the head just above the eyebrows. Additionally, both ears should be gently plugged with a cotton piece to avoid the spilling of liquid into the ear and eyes. Procedure, the patient, as you can see in the video also, the patient should recline in a supine position on the treatment table, that is droni, with a small pillow positioned beneath the neck of the for the comfort. The dhara pot should be strategically placed to ensure a continuous and controlled flow of the liquid over the patient's forehead. The tip of the dharavarti should be maintained at a distance of 4 to 5 centimeter above the patient's forehead, with the total wick length spanning between the 8 to 10 centimeter. Any buttermilk that drips from the patient's forehead should be collected and carefully poured back into the vessel from which it originated. It is essential to keep the vessel in a constant motion, ensuring that the medicated buttermilk cascades smoothly over the patient's entire forehead without interruption. Summary of the procedure is, all the procedures of Takradhara are akin to those Shirodhara, with the key distinction being that the Takra or buttermilk should not be heated or recycled for the therapy. This is the most important part of the Takradhara. Post-operative of the procedure is, following the Dhara session, the hair is rinsed with Amalaki Kwatha, which we already 500 kashaya we kept aside. With that kashaya, we rinse the head of the patient. Subsequently, the head should be gently dried with a towel, and Rasnadi Churna or dry talam is applied on the scalp or bregma. A bath should be taken after the passage of one yama, or there is a 45 minutes after the Shirodhara. The patient is then encouraged to rest for a duration equivalent to the length of the procedure, but patient should not sleep. So, the next procedure is the same like Takradhara, but we use milk instead of the dhara, and it known as a Kshiradhara. The indications of Kshiradhara is insanity, that is psychotic conditions, epilepsy, that is apasmara, insomnia, burning sensation of the head or headache. Whenever there is pitta predominance in the symptom or in the disease, we use the Shirodhara with Kshira or milk. In this preparation, the 2 prastha of cow milk diluted with 8 prastha of water, add 1 pala each of bala and tubers of shatavari, all well washed, crushed and packed loose in a muslin bag and tied up. Boil and reduce to the quantity of milk, remove muslin bag, dilute with equal quantity of fresh tender coconut water, that can be also done, or plain milk dhara or plain dhara with coconut water also is being practiced. There are the scope of research studies. Many researches has been done on the Takradhara and Shirodhara. So, here are the glimpse of researches. The pressure of oil on the forehead creates a vibration, and then the oil saturates the forehead and scalp and penetrates the nervous system. Gentle pressure and soothing warmth of oil allows the body, mind and nervous system to experience a deep state of relaxation. This is what happening in the Shirodhara. This vibration along with little temperature may activate the functions of the thalamus and basal forebrain, which then brings the amount of serotonin and catecholamine to the normal stage, which inducing the sleep. Material used for Shirodhara should be comfortably warm, which causes vasodilatation of all the channels and thereby improving their circulations, which in turn improves the blood circulation of the brain. Improvement in the circulation to the hypothalamus also improves the function of autonomic nervous system, and its stimulation during stress causes many psychological disturbances. The person experiences unexplainable relaxation and brightness, which provides complete rest to the mind, allowing one to overcome stress related conditions like insomnia, anxiety, chronic headache, hypertension and asthma. It also strengthens the hair and skin of the head. That is why it shows a better result in the hair fall or diseases of the scalp or hair. In the spring 1995 issue of the Journal of Ayurvedic Institute, that is Ayurveda Today, the Ayurvedic practitioner, that is Ed Danaher, explained how Shirodhara affects the stress. Stress, according to Ayurveda, is a state of imbalance of pranavayu, sadhak pitta and tarpak kapha. Shirodhara re-establish the functional integrity between these 3 doshic subtypes and thus helps alleviating stress. In the procedure of Shirodhara, pressure and vibration is created over the forehead. The vibration is amplified by the hollow sinus present in the frontal bone. The vibration is then transmitted inward through the fluid medium of cerebrospinal fluid or CSF. It is explained in modern textbook of physiology also that the pressure has an effect on impulse condition through the tactile and thermoreceptor. If prolonged pressure is applied to a nerve, impulse conduction is interrupted and part of the body may go to the rest. In Dhara therapy, prolonged and continuous pressure due to pouring of the medicated liquid may cause tranquility of mind and induce natural sleep. Shirodhara is deeply relaxing and induces a relaxant state. These effects are mediated by the brain wave coherence, alpha waves, and a down regulation of the sympathetic outflow. A center of forehead, which was evolution wise related to the third eye, is connected to the pineal gland. This spot is known as a Agneya chakra in the yoga tradition. Focusing on the Agneya chakra with closed eyes during the meditation leads to the psychosomatic harmony. As the oil drips on the Agneya chakra, it is proposed that the meditation like effect is a consequence of stillness of mind leading to the adaptive response to the basal stress. Shirodhara brings in several benefits including improved blood circulation to the brain, provides nourishment to hair and scalp, reduces nervous tension and helps in sound sleep. There can also be different condition of head, throat, eyes, ear and nose. It improves the functioning of the sense organs and central nervous system, also improves your mood and fights the depression. Takradhara elevates the dyspnea, sleeplessness, shiroruk or pain in the head or headache, brahma and hypertension. Sthapani marma between the eyebrows has been mentioned by Sushruta. It is the Shira marma of the Vishallagna variety. This sthapani or Kurchamarma appears to be a mediator of the Takradhara hypothesis effect. Because it is the Shira marma, it may have a reflex effect on the baroreceptors which are disrupted in the essential hypertension and may be help accountable for the construction of arterioles that result in an increase in the blood pressure. With this, thank you all.